Hello everyone, welcome to Simplifying Comprehensive Care Coordination. Today we'll accompany Lee Wang on her journey as she navigates through various care locations where existing data is accessible by all of our healthcare organizations using a collective ecosystem to maximize patient value and decelerate healthcare's unsustainable costs. Lee has type 2 diabetes. She was recently widowed and moved to assisted living. From her assisted living facility, Lee gets admitted to the ED for diabetic ketoacidosis and a lower extremity wound. Her provider is concerned she'll return to the ED as she has many times before without proactive care. We'll follow her from her hospital discharge to home health and all the way through hospice care at her assisted living facility. By using digital solutions that meet modern patient care expectations, we can put Lee at the center of her care. Her journey will incorporate various parts of the healthcare ecosystem using 360X, Care Quality, Commonwealth, Direct Secure Messaging, HL7, FHIR, and a nationwide clinical data network. We'll leverage shared data across multiple encounters on a complex patient case with shared medical records across technical, organizational, and geographic boundaries. Hello, my name is Steve Bauman with STC Health. Lee's immunization information is in the state registry, EHR, HEI, and have direct connections via an electronic interface and can send and receive real-time information for all patients using an exchange and HL7 messaging. In addition to viewing the complete patient immunization record, STC Health platform provides immunization forecasting, information to indicate when the next vaccine in a series is due, while also validating that all vaccines received to this point are valid and were given within the correct time intervals. Should a patient need an adjusted forecast due to an existing condition that affects their vaccine schedule, the forecaster can accommodate and make the adjustment as needed. And now we'll transition over to Lauren at Oracle Health.
Thanks, Steve. My name is Lauren Krupper with Oracle Health, and in this scenario, I'm going to be playing the role of the provider for her inpatient stay. So as mentioned, Lee Wang presents to the ICU with the chief complaint of ketoacidosis and a left diabetic foot ulcer. Launching the record exchange summary view allows us to view the Commonwealth external data and quickly gain insight into the patient's history and conditions. So as you can see, the Commonwealth data shows specific lab results, immunizations, vital signs, medications, all in one single view for the provider to get a quick and accurate view of the presenting patient. After viewing Lee Wang's summary, we utilize Oracle Health's workflow and pages to efficiently transition Ms. Wang's care. Seamless exchange enablement on these M pages allows for her outside records and local chart information to be viewed side by side and streamline the process of reconciliation. As part of seamless exchange, her immunizations were received from the registry, as well as other sources such as the STC Health Immunization Query, Commonwealth, and Care Quality to directly write to her patient's chart. This reduces the amount of time that the provider has to spend on reconciliation. So as you can see on the right-hand side of my screen are all the information that came from STC Health Immunization Record, as well as any additional items on the left to be reconciled even further with our seamless exchange workflow. Following the view of her immunizations, the provider goes to do the reconciliation of the home medications. Again, using the seamless exchange workflow, there's a powerful deduplication engine as part of the product that filters out all the noise, allowing Dr. Penny to really view what is net new to the patient's chart. So again, the side-by-side view within Seamless Exchange shows any of the items that do still need to have reconciliation, as well as the home medications within her current record. So after medical management during her stay, Lee Wang's condition has improved and a referral order is going to be placed to continue her care with home health. So launching the new order entry window, you will see that the referral order has been saved as a favorite for this provider. So we'll just need to confirm that it's going to be routed to the correct location. By doing this, we'll modify the details. And ensure that we are placing the referral order to Matrix Care. And from here, the patient is ready for discharge. So a secondary order or secondary referral order is also placed for home medical equipment for wound vac and supplies and sent to Brightree via HL7 V2. Lee Wang is now discharged, and upon her discharge, H&P and discharge summaries are shared with Commonwealth Care Quality to follow her care journey, and discharge orders and referrals are also placed through CCDA direct secure messaging to Matrix Care. With that, I'll transition over to Brightree to follow up on her referral orders.
Thank you, Lauren. Hello, I am Kim Katz, the ePrescribe Program Manager for Brightree. Today on Lee's Journey, I will show you the events for the home medical equipment provider, and this is inside the Brightree's referral management work list. We will walk through the detailed data elements from Oracle using the exchange of the HL7 messages, capturing the HME physician referral from Baseline Center to Brightree. As Oracle mentioned, Lee Wang is having difficulty managing her care and is discharging back to her assisted living facility. Dr. Penny orders a negative pressure wound therapy device and supplies. This is done inside Oracle's native power chart. Once the order is completed, it is then parsed over and received into Brightree's referral management work list. Here, the HME will receive an alert notification in real time, and with the automation and reconciliation tools done inside Brightree, here the patient record is created as well as a sales order created, showing the referral source, the patient name, the time and date, as well as the status of the order, and also sent into a WIP state. If I go into the referral ID, you will see all the information accepted. I am going to search by the referral source. And this one here is going to be for Oracle. Once I see in here that the referral came over in real time, capturing a standard written order. Here is all Lee Wang's information, demographics, insurance, checking insurance eligibility behind the scenes, as well as the date of her discharge, instructions on where to order the equipment, emergency contact, and the items ordered. If you go in each tab, there's hyperlinks showing the patient information, the medical record, addresses, ICD-10 codes, height and weight, ordering provider. Insurance tab, as we mentioned, will check eligibility. Also, a map to your previous payers inside your database. The sales order is going to be created, again through the automation and reconciliation, to show the item being ordered. Here is where the negative pressure wound therapy pump will land. In the history tab, it's going to show an audit trail of everything that has been done inside the system, or if any of the intake team members or clinical team have touched the order, it will show you a trail. If something needs to be revised or sent back to the ordering provider, it can be done so through a CMN sent back to the ordering provider, landing back into Brightree's document management. Once the device is delivered to the hospital room, Lee will be ready to begin her home health journey, and then return to assisted living facility. This comprehensive solution enables the HME providers to streamline the process and manage their entire business from one cloud-based system for greater efficiency and to increase profitability. Brightree shared today an example of interoperability, allowing the HME to dispense their products seamlessly and securely to provide a better patient outcome and a better user outcome. Next on Lee's journey is her care with home health. Here is Margaret with Matrix Care.
Thank you, Kim. I'm Margaret Morris with Matrix Care, and I will be representing home health and hospice. Lee returns back to her assisted living facility with home health orders. The orders that are received from Oracle Health will populate into our referral management work list. These referral orders have been received through HL7, CCDA, via direct secure messaging. Matrix Care is able to consume and parse most of the information from the CCD, including patient demographics and insurance information, diagnoses, allergies, and medications. Through our medication import, we can extract the medications off the CCD and share them out to the mobile device to assist the clinician in the field with reconciling those medications. Without medication import, many agencies report 30 to 40 minutes to do medication reconciliation. This is a huge time savers for clinicians. The patient is ultimately admitted to home health, and you can see here, we're also pulling in documentation from Commonwealth through FHIR. We can see several different documents that have been shared from Baseline Health, including things like the referral note, discharge note, and H&Ps. We can pull these documents directly into Matrix Care for the clinician to view at point of care. Nursing and physical therapy services are initiated, and after about 4 weeks of service, the patient is discharged from home health. You can see here documentation such as the discharge summary from PT and the agency discharge summary from nursing. This information is automatically shared up to Commonwealth, along with things like admission, discharge, and transfer notifications. After the patient is discharged from home health, the care journey will now transition to NextGen.
Thank you, Margaret. My name is Bruce McGregor. I'm an engineering manager at NextGen Healthcare. I'll be representing the oncologist for Lee's journey. Approximately a month and a half after Lee is experiencing some back pain, and it's not responding well to over-the-counter medications, so she visits her primary care physician at the NextGen family practice. The primary care physician runs some lab results and finds that the patient has multiple myeloma, so he wants to refer her to a oncology specialist for evaluation and treatment. This is where we'll pick up our story. The referral was sent via 360X from the NextGen family practice to the NextGen specialty practice. In order to manage this, we're going to open up the NextGen data share module and navigate into the closed loop referrals screen. Here we can see the referral for oncology evaluation and treatment. And from here we can manage the referral. We can either accept or decline it. In this case, I'm going to accept the referral. This is going to create a message on the back end, which goes back to the referring provider to let them know that I have accepted treatment of the patient. From here, we can also see the audit trail and additional information about the referral. And if we go into the initiated record, we can see that there's a CDA document attached to it. We open up the CDA document into our CDA viewer, and here we can see the clinical information that's associated with the referral. I see here that there are some lab results that are critical to our case, so I'm going to go ahead and import these into the patient's chart by using our one-click reconciliation. And here we can see that these lab results are going to be added into the patient's chart. So when I click confirm, these will be imported. Now that those lab results are on the chart, we can close this document. Some additional testing is performed, and we do determine that the diagnosis of multiple myeloma was indeed correct and that the disease is in an advanced stage with a poor prognosis due to comorbidities and the frailty of the patient. The patient is elected to go on to hospice care. So in order to respect the wishes of the patient, we're going to refer them to the Matrix Care hospice facility. To do that, we're going to open up the referral management template. And from here, we can select the specialty. In this case, we're looking for hospice and palliative medicine. And we're going to select the relative diagnosis for the referral. And we're going to add the referral order to the patient's chart. Once it's on the patient's chart, I can come back over to the data share module to initiate the referral and create the 360X loop. So I'm going to select the patient or the provider that I want to send it to. In this case, we're going to send it to a practice at Matrix Care. And we're going to select the associated referral. And we're also going to enter a reason for the referral. In the clinical information section, we have the ability to select different profiles for clinical information inclusion. This includes encounter level, encounter plus clinical context, longitudinal, and we also have manual data selection options. In this case, I want to send a longitudinal record, so it's the entire patient record. I'm going to click the preview button, and now it's going to generate a document in the back end. Once the document has finished generating, it's going to be forwarded into the CDA viewer so that we can review it. And here we can see the allergies, medications, problems, including all the previous diagnosis, lab results, and advanced directives, including Lee's DNR. Now we're going to click on the export button. When we click the export button, the document is packaged up in a 360X message and sent out to the provider that we want to send the referral to. I can now come back to the closed loop referral screen, and I can see that the referral was initiated and sent out for hospice care. We still have the original referral that came in from the primary care physician, and now that I've completed the evaluation, we're going to send an outcome note to close this loop. So we're going to click the Send Outcome button, and as we can see that the provider is already selected and a title is pre-populated, and we are also going to select a longitudinal export type here as well, so it's the entire record. We click Preview, and this will again generate a document and forward it into our CDA viewer for review. Now I'm going to click the Export button, and this is going to package up that document and send it back to the initiating provider. Now we can see that the referral is now finalized, and this closes the loop with the primary care physician. I'm now going to pass it over to Mary from Matrix Care.
Thanks, Bruce. I'm Mary Camp from Matrix Care Facilities, and I'm going to show you how easy it is to manage transitions of care by leveraging the incredible power of being connected to CareQuality's nationwide framework of providers. So I'm on Lee Wang's care team at her assisted living facility, and I'm going to use Matrix Care Connect to retrieve Lee's hospice referral from NextGen, and then we're going to use that referral to transfer her new medication orders to the assisted living facility. So our care team has already set up our referral network down here, which Matrix Care Connect uses by default to narrow our list to search. If you're looking for a document or a file that is outside your regular referral network, you can click over to the organization or area info screen and search by name or city and state or by zip code. So I am going to search for NextGen because I know I'm getting my document from them, and I'm going to click Document Search. And when I initiate that search, we're looping out to CareQuality and looking for a document specifically from NextGen to bring back into Matrix Care Connect. There we go. Okay, so we just uploaded our document from NextGen, and if I want to preview it, I can look at the document and make sure that it has the information in it that I need. I can go back to the document search screen and then just click to import it. So once that document comes into Matrix Care Connect, then I'm going to use the Send EHR button to send it over to our assisted living inbox. So over here on the inbox on the assisted living side, I'm going to reconcile my document. This is the one that just came in on me. And we have 4 tabs running across the top. There's demographics, diagnoses, allergies, and medications. I've already done the first 3 tabs to save some time. I'm going to pop over to medication reconciliation. On the left-hand side are the source orders, and these are the orders that are coming out of the document that we just imported from NextGen. On the right-hand side, we have anticipated orders, and these are the orders that will be moving over into our assisted living electronic medical record. So just as an example, I'm going to modify this first order for Ativan. And you can see up here I have the order from source, which is the document that we just imported from NextGen. And we've made it really easy here for the end user to make changes to this order. So you can change the dose, the frequency, or the route, put in whatever you need to do. And I'm just going to add a diagnosis here and a reason, and I'm going to save and continue my order. So you can see that Ativan order went from over here, and now it's over on the anticipated order side. So once you've addressed all of the source orders, you complete a drug utilization review. And here, I'm just going to select a common override reason for these couple of orders and apply it and acknowledge that drug utilization review. At this point, the orders are approved and we're done. So to sum up, using Matrix Care Connect's ability to execute a care quality search, you can quickly find and import the documentation you need at the time that you need it, and then leverage that documentation to update the patient's record. It really cuts down on time and it virtually eliminates transcription errors, and ultimately it allows caregivers to do what they do best, which is take care of patients. And with that, I'm going to pass it over to Margaret with Matrix Care Hospice.
Thank you, Mary. Matrix Care Hospice receives the referral from NextGen through 360X. It will land in the referral management work list. And similar to what we saw with the prior referral, we're able to consume the information shared through 360X and parse that into the referral management tool in Matrix Care. Lee continues her care on hospice while her providers continue to share information about her care. In conclusion, thank you for accompanying us on the seamless care coordination journey for Lee Wang. We were able to use standards-based technology and comprehensive and integrated approaches to help support the continuity of care and improve Lee Wang's transition of care, helping to inform better care decisions, reduce readmissions, decrease total cost of patient care, increase provider satisfaction while improving the patient experience, and ultimately allowing Lee to focus more on living her life and less on managing her care.